Hello and welcome to Chapter 7. This is Patient and Specimen Requirements, and we are going to talk about quite a few things here. We're going to talk about the laboratory requisition or the laboratory order, professional communication that you will be using as a phlebotomist when you're going in for the phlebotomy procedure, ethical and legal standards as they apply to you, proper patient and specimen identification, which is critical. We want to also know and understand some different factors that can actually affect both the specimen quality and test results. And some of these are influenced by the phlebotomist, but a lot of these are outside of our control, like environmental factors. And finally, we're going to talk about the role of the phlebotomist in the documentation process. So these are examples of some laboratory requisitions. The process of phlebotomy actually begins with the order itself. So someone places an order for a certain test to be performed. Often these orders are entered into an electronic health record or an electronic medical record, the EMR or EHR. As a phlebotomist, you have to be able to kind of quickly and accurately, most importantly, interpret these requisitions and know what you need and what needs to be drawn. All requisitions are required to have a certain information, and this list here is that. And there's some additional information that can be added to certain lab requisitions, and I'll touch on that a bit. But all lab requisitions must contain the patient's name and date of birth, the patient's medical record number, the patient's location if they're inpatient, the ordering physician's name, the type of test to be performed, the test status, as in is it stat, is it timed, is it fasting, is it routine, the date and time that the test is performed, and your initials. So additional information that you might see on the requisition might be a barcode if you have a computer scanning system, type of anticoagulant tube that's required if that test does require one. If there's a certain volume required, that might also be included on the test. Now, stat testing, well, I'll touch on that real quick. Stat testing means that it needs to be collected and transported immediately to the lab to be run. ASAP means as soon as possible. You might see routine, abbreviated as RT. That is collection times that are determined by the facility. So every morning at 6 a.m., you go do your routine labs, for example. Timed labs, some tests require specific time for collection. And we'll talk a little bit more about that when we talk about. An example would be to monitor therapeutic drug levels. We draw a peak and trough. That's an example. Or fasting. That's another example of a time. You have to get that lab only after the patient has not had anything to eat or drink other than water in at least 12 hours. So sometimes the timing of these is important, and that will be documented on there as well. Professional communication. So we've talked a little bit about professionalism already. So this is going to be a little bit of repeat, but just something to touch on specifically as we're talking about going into the room to take a specimen. So you have to exude some confidence, okay? Because if you think about it, patients can be anxious, they might even be combative, they might just be scared. So how you approach that patient, the situation, your attitude will put the patient at ease and can also help in distracting the patient away from the actual phlebotomy procedure. You want to remain calm, smile, speak in a pleasant tone, be courteous and respectful. You may hear that called good bedside manner. All of this helps to develop a rapport as well. What we mean by rapport is that confidence in you as a phlebotomist, that trust that you build. It can happen really quickly. And when you're a phlebotomist about to go in and stick somebody, you need to develop rapport, you need to have good bedside manner and establish that trust quickly. Some things to remember, you always want to knock before entering the patient's room. Even if the door's open, you want to kind of knock, pause for a few moments, and wait for a response. Now, we know that sometimes patients aren't going to respond. This can be for various reasons. They can't hear you, they're sleeping, they're sedated, they've got tubes. So you can walk into those rooms after you've taken that pause. You definitely want to introduce yourself as you're walking in. Knock, knock. Hey, Mr. Smith, it's Shannon, your phlebotomist. I was just coming in to get your labs for the morning. Introduce yourself, who you are, what you're going to be doing, and you can also explain a little bit about how the procedure is going to go. It's also important if the door is closed to open it slowly. If you've ever been inside a hospital room, you know they don't all have a whole lot of space. So you don't want to knock somebody over. Sometimes there's going to be a curtain as well. This could be in the hospital or in like a nursing home, for example. You also want to treat the curtain as a privacy barrier as well. So if a curtain is pulled, you might want to assume that something might be going on, like they're using the bathroom, they're getting a treatment, they're getting a bed bath, they might be changing their clothes. So you don't want to just swing that curtain open. Talk to the patient through the curtain first and make sure it's okay to open or enter. Let's see. So of course, there's some special considerations when working with children, developmentally delayed, and even sometimes with geriatric patients. The main thing is to keep the child distracted if you can. And we do that a lot of times by talking to them. So talk to them. There's some other techniques that you can learn, especially if this is the population you work with regularly. You're going to be coming up with amazing tricks that I can't even think of right now. Don't ever lie to the patient. Don't tell them it's not going to hurt. A lot of times you'll hear the phlebotomist say something like, you're going to feel a quick little sting and then I'll be done. So speed without jeopardizing safety is important, especially when you're working with kids. When there is a caregiver present, if it's possible, have them get involved and help, but also realize that sometimes the parents or the caregivers might be just as anxious and nervous as they are. You want to think about your terminology. They're not going to understand what a tourniquet is. So rubber band is, use that. Or if they see the catheter of an IV, plastic straw. When tying the tourniquet, you can tell them, look how big their muscles are. So you got to be creative with kids and sometimes with individuals with developmental delays. Again, distraction and kind of some common sense can really make a big difference. Some other distraction techniques, counting, music, give them a movie to watch. I know when my daughter had to have a tooth pulled because she knocked it out, almost knocked it out. The dentist had a video on the ceiling. I know that's not phlebotomy, but it was a great example. She had no idea the whole time anything was going on because she was watching a cartoon on the ceiling. Positioning for comfort's important. So various things that you can try. There's also numbing products, and these can be used for kids or adults. You don't always need to use these, but these can be something that can be beneficial and helpful if you have access to them. They basically are sprayed onto the site where you're going to do the venipuncture, and it just numbs it a little bit. I think there was one more thing I was going to say about that. Let me make sure. Oh, I mentioned geriatrics. So geriatrics also, really when I talk about when I mean special considerations for them, not everybody, but as we tend to age, we do have a decrease in hearing, sometimes a decrease in vision. So just expect that with some of the geriatric population, especially if they have something like Alzheimer's or dementia, in addition to, you might have to repeat yourself, give instructions multiple times. So just be compassionate and patient with these individuals. Some other things to keep in mind is you might also get asked questions about the tests that are going to be run. Just remember, it's not your job or your position as a phlebotomist to talk about tests and test results. Some of the things you can say is, well, this is routine tests that the doctor uses to treat or diagnose whatever it is that you have going on. Or if they're asking about results, say, this is not something that I'm allowed to discuss, but you're definitely welcome to talk to your physician directly about this. And usually that is enough to appease them. One thing to keep in mind, we talk about patients oftentimes are going to feel a little anxious or scared, sometimes could get a little combative. Now, if it gets to that stage where a patient is combative or hostile, that's not when you should stay there and try and continue to stick them. If you ever start to worry about safety, you need to just politely and calmly, but quickly leave the room and let a provider know as soon as possible. But always remain professional and polite. So healthcare ethics and laws. Knowing basically how laws and ethics apply to the phlebotomist helps you to really be able to do your job to the full capacity. So when you know what you're legally allowed to do and not do, that's ideal, or you have to know that. It helps you to provide compassionate and competent care, and it also helps you to avoid legal issues, right? So law is basically a rule of conduct, or action that is set out to provide, to protect society, protect the public, okay? And if a law is broken, then we can be brought to trial, basically, essentially. So a couple of things that you could be looking at in the healthcare realm as a phlebotomist, hopefully not ever, but assault, that's threat of bodily harm. If you don't hold still, I'm going to tie your arm down. Don't do that. Battery, that's when you actually touch the patient. So assault is threat, but not actually touching, whereas battery is when you've actually touched. So you've actually harmed the patient, or you've done something without their permission, touched their body without permission. So that could be as the patient saying, no, you may not draw my blood, and you draw it anyway. So that would be assault and battery. Negligence is when a professional neglects, so professional in this case, the phlebotomist, right, you guys, neglects to perform in the manner expected by that profession. Usually negligence is the basis for malpractice suits. So you don't want to have that happen, obviously, but it's kind of, there's a few basic things that you can do to make sure to avoid negligence. The first thing is to just care about what you're doing, care about your job, care about your patients and how you're performing. Communicate. If you're communicating clearly with your patients and making sure that they're understanding what you're telling them and what you're going to be doing, that's going to be another step you can take to prevent something like that from happening. Competence, that's knowing how to do your job, whether that be what you can do and also what your own personal limitations are or your professional limitations. And finally, it's participating and doing your continuing education that is required every 2 years to keep you up to date on the most current knowledge and practice. Now we're going to talk about HIPAA. So, I'm sorry, I'm going to back up actually, because I do want to talk about informed consent before I go over to HIPAA. So all patients have rights. Patients have the right to refuse care. They have the right to be treated with respect. They have the right to have all records and information classified as confidential, the right to be informed about the purpose and expected results of any treatment, and the right to have access to their own medical records. Informed consent is a really important aspect of your job as a phlebotomist. Informed consent is your responsibility before you begin any phlebotomy procedure. So you have to explain the procedure to the patient before you get started. And you also need to make sure that you're using terms that they'll understand. So non-medical simple terms are best. Finally, you need to ensure that the patient has understood what you have just said is going to happen. And in that case, you can get consent. Consent can typically be written, verbal, or implied. And typically as a phlebotomist, you're getting verbal or implied consent. Verbal would be like, yes, you may draw my blood. Implied consent would be you saying, may I have your arm so that I can draw some blood for this morning's labs? And they reach their arm out to you and offer it up, okay? All right, so let's hop over to HIPAA. HIPAA is the Health Insurance Portability and Accountability Act. HIPAA was established, or I should say HIPAA established national standards for electronic healthcare transactions so that they could protect the privacy and confidentiality of patient information. HIPAA guidelines that apply to phlebotomy in particular, you have to make sure that you close the patient's room door when caring for them or discussing their health in any way. Don't talk about patients in public places. Make sure that any computer screens, if someone was walking by, they wouldn't be able to visualize the computer screen and personal health information. Log off all computers when you step away or are done. And don't walk away from patient medical records, as in don't leave them out on a desk. If you're done with the patient medical records, you need to at minimum flip it over so it can't be seen, or then put it back where it goes. Violations of HIPAA can result in fines and losing your job, so termination. Real quick, before we move on to patient identification, if you have a patient who refuses a lab draw, because it does happen from time to time, the first step, and this applies to any time you're about to do any kind of activity or procedure with a patient, if you ever go on to be a CNA or a nurse, for example. But if you're a phlebotomist and someone refuses, the first step is educate the patient. Tell them why you're doing it, what it's for, and what the purpose is. And for phlebotomy, it might be as simple as I know you don't want your labs drawn because I know it's not fun, but these labs are really important for your doctor to be able to know how to treat you as best as they can. So that's why I'm here to draw these labs. Would you mind if I please do this? Because I know your doctor would like this information, something along those lines. If they still refuse after that, then you just politely leave the room and you want to let the nurse or physician for that patient know right away. And you also want to document in a detailed manner. So document a detailed account of that interaction with the patient, what you tried to do, and what didn't work. Be sure to include the name of who you reported it to. So if you told Jim RN right after, document that. Jim RN notified of patient's refusal. And then, of course, we're always dating and timing our documentation and then notifying our lab supervisor as well. Okay, so patient identification. This is the top priority for patient safety. The National Patient Safety Goals, which was established by the Joint Commission, so you're familiar with those two organizations, recommend using at least 2 patient identifiers, and one of them is not allowed to be the room number. That's not very reliable. You need 2 patient identifiers at least before you perform any kind of procedure. Proper identification is actually a 3-step process, and we're going to talk about that here. If at any point in this process you have doubt or hesitation, you stop and get more information, more clarification and validation before you proceed with the procedure. So you want to ask the patient to state and spell his or her full name and date of birth. You want to compare the name on the test requisition form or slip to the label. And you're comparing that with the patient's response. Finally, you're looking, if it's the inpatient setting, you're looking at the patient's armband and making sure that the name and date of birth match the requisition and the verbalized statement of their name and date of birth. So again, those 3 parts all have to match up. If even one letter or one number is off, you do not proceed until you get that either fixed or clarified. Sometimes you may work at a facility with a barcode system. Even if you scan an ID band and with a barcode, you are still getting doing this 3-step process, still having them verify their name and checking the order against the requisition, or the label against the requisition, excuse me. When you're in the outpatient setting, really what differs here is that when the patient walks into the facility to get the lab, they go to registration first. And at registration, whoever's there, they're verifying identity as well by using typically a government issued ID to enter and register this individual. And when they come back to you as the phlebotomist, you're still going through this 3-step process. You're having them state their name and date of birth. You're comparing it to the order requisition, and then you're going to compare it to the label that is created. So it's always a 3-way or 3-step process. So we've talked about identifying the patients. Specimen identification is also really important. And when we say that, we're talking about labeling of specimens. Unlabeled specimens or specimens where the labels are torn or twisted or can't be read are just discarded. You can't process those, and then you're going to have to redraw. So mislabeling can be really dangerous. Mislabeling the specimen and or not properly identifying the resident or patient can be disastrous or deadly in some instances. Labeling, all specimens must be labeled before leaving the patient's room, but after collection. And I'll probably say that again. So CLSI, or the Clinical Laboratory Standards Institute, came up with the standards for how we label a specimen correctly. And that's here. It has to have patient's full name and date of birth, a unique patient identifier, like a medical record number, for example, the collection date and time of the specimen, and your initials. Some other things that may be included on the lab, but aren't these are the core basic have to have. You may also have things like the ordering physician's name, special specimen requirements, or handling instructions. Like I mentioned, labeling should be smooth and straight. You also don't want to cover the entire contents of the tube so that it can be visualized. So again, just make sure that as soon as you finish drawing that blood, that's when you can put the label on the tube. and you don't want to do it after you've left the room. It needs to all be done within that same space. So like I mentioned, there are some factors that can affect both the quality of the specimen and the result. Laboratory tests results depend not only on how you're actually collecting it, but some of these things as well. So I'm just going to touch a little bit on these. Now, again, not all of these you have control over, but it's as important as a phlebotomist to understand how these different things can affect the labs that we are drawing. So altitude. I'm not going to go too into detail on these, but basically altitude, depending on what your altitude is where you live, the normal reference ranges for different various labs can vary. So we need to know that. Geographic location, we're talking what's in the water, what's in the air, pollution. These can change the composition of our body, right? And what's in our blood. Temperature. Changes in temperature can affect the distribution of electrolytes in our blood and change those results. Hydration, if we are dehydrated or if we are basically hemodiluted over, we have too much water, that can change the composition of the blood as well and the concentration of different analytes in our blood. Posture, exercise, and stress, those kind of go together because they have similar, they cause similar things to happen to the lab results. Basically, strenuous exercise, stress, like being anxious or fear, can have similar changes in the composition. For example, strenuous exercise can cause a temporary increase in white blood cells and various enzymes and other chemical levels. And I think that's it for those. And I already mentioned the timing. So specifically, here we go. So timing of specimen collection is another factor. And this one, we as a phlebotomist do need to be aware of and make sure we're doing it at the appropriate time. Fasting, I think I mentioned that already, but that's when you need the patient to be having not eaten or drank anything other than water for 12 hours prior to the specimen collection. Diurnal variation, this is basically when they want to see the variations in certain levels of hormones, is a great example of hormones throughout the day in our body. So you might need to take blood samples at certain times as they're monitoring these varying levels of hormones. Postprandial, that's just after eating. I mentioned the therapeutic drug monitoring. This is the peak and trough levels. So peak levels, this is when you draw blood when it's expected to have the highest concentration of that drug in the body to see what we're trying to keep therapeutic levels, right? So we want to see the peak, what's the highest that level is in the blood, and then the trough, that's the lowest. And typically that's when you draw blood right before the next dose is due. That's when it's expected to have the lowest levels in the blood. And the doctor monitors this to know what's the appropriate dosage and what are the appropriate times to take the medicine as well. So timing is super important when they're trying to monitor drug levels in the blood. Specimen transporting and processing. Laboratory test results can be greatly affected by the way specimens are handled and transported. And that is also a crucial role of the phlebotomist. So our job doesn't stop just when we get that blood sample. You have to be aware and carry out any special handling or transporting orders that are given to you. And finally, something I wanted to just mention to you guys as well is we talked a little bit about documenting in the electronic health record. As we're accessing the electronic health record, this is part of HIPAA. Just remember, it's really important that we only access the information that is relevant to our particular job and that particular patient. So if I'm drawing blood on Mr. Smith and I'm just really curious about what happened to his leg because it's all mangled, I don't have the right to go throughout his whole chart to find out the backstory to his leg. That's not relevant to my particular job. So that would be a HIPAA violation. Or if I notice that my neighbor is in the room over, I can't pull up my neighbor's chart to see why she's sick and in the hospital. So just make sure you know that as well. You're only accessing the particular information that is relevant to your job with that patient. All right, and that is it. Thank you, guys.